Hello and welcome to Red Cup Conversations. I'm your host, Kris Poliquin, and this is a production of Red Apples Media. If you're watching us on television, you're doing so on Lake Sumter TV, Comcast Channel 13, Bright House 498, and Spectrum Channel 83. So today we're going to be speaking with Dr. Samuel Moak from Lake ENT, and we're going to discuss what he does there, maybe some trends, if that's okay, and kind of how he got into this line of work in the first place. So, Dr. Moak, thank you for joining us on our show.
It's a pleasure to be here, Kris. Thank you for having me.
Oh, yeah. I find this interesting just because I don't know anything about it. But let's start with you. Can you tell us a little bit about yourself and what you do at Lake ENT?
So, from a professional standpoint, I'm a board-certified otolaryngologist or ear, nose, and throat doctor who's done further fellowship training in facial, plastic, and reconstructive surgery, and that encompasses both cosmetic and reconstructive procedures of the head and neck. I did that fellowship in Alabama under the tutelage of Dr. Galen McCullough at the McCullough Plastic Surgery Clinic. I did my otolaryngology or ENT training at the University of Tennessee in Memphis.
Oh, really?
I did, yeah.
I'm sorry.
Yeah, home of rock and roll.
UGA, just saying. But
okay, yeah. But no, I spent 5 years there, learning all aspects of ear, nose, and throat surgery. It was a great experience. Prior to that, I did my medical school training in Tulane, in New Orleans. So I've kind of been all over the Southeast. I'm originally from Mississippi, a small town. My dad's a physician there. He's sort of he's an internist, mainly practices cardiology, heart-related medicine, but he kind of does everything. He's sort of a jack of all trades physician.
okay.
And that's how I initially got interested in practicing medicine. Was kind of grew up in his clinic under his tutelage.
Right.
He and I are very close, and that's what I've always wanted to be. I didn't really consider doing anything else. I got interested in ear, nose, and throat because I was interested in surgery. I liked the idea that you could fix problems immediately and give patients relief, you could make an immediate impact. And in med school, I rotated under different services, and I really enjoyed working with ear, nose, and throat residents and attendings, and learning about that anatomy. And that particular area of the body really intrigued me because of its intricacy and interrelatedness. I really, when I saw my first rhinoplasty and then later first facelift, that's when I decided that's what I really wanted to do. Because it's both artistic and architectural medicine, it's rejuvenative medicine, and you really do make an impact on people when you're able to help them feel better about themselves and rejuvenate them. And so I went into ENT kind of being interested in facial plastic surgery, but in Memphis, I worked with Dr. Philip Langston, who's now the outgoing president of the AAFPRS. And that's when it really solidified my interest in facial plastic surgery, and I pursued a fellowship in it.
Really?
Yeah.
So that wasn't your intentional direction, I should say. You just kind of, I don't want to say fell into it, but I guess the opportunity came up.
Had an interest in it, and then it got further solidified in residency. And I think that's true of a lot of people in the field that they go into. Some of them, people start out med school saying, I'm going to do this, I'm going to be a heart surgeon, and they end up being a psychiatrist. And
right.
It's sort of, you go in with certain assumptions and certain ideas, and granted all that changes because you enter med school. A lot of people enter in their early 20s, they leave in their late 20s, they finish residency in their mid 30s. And some people that's even more staggered out. And so I think you change a lot and you experience a lot of different things. You have to be open, is the best way to say it, open to where your path leads you.
Yeah.
Yeah.
Oh, absolutely. And now, how long have you been doing this?
So,
well, more specifically, the facial plastic surgery.
I did quite a bit of it in residency, mainly more reconstructive type procedures.
Uh-huh.
We had our own resident run clinic at the VA, and then later at Methodist Hospital. And so I was able to do some of that in residency and kind of take leadership in that without as much oversight. And then in fellowship, it was opened up a whole new world. Dr. McCullough has been around. He's been practicing for over 40 years. He's trained almost 100 fellows, and so was able to pick up on his techniques, learn his philosophy of practice. And it's something I carry with me every day. So I wouldn't trade that fellowship training for anything. But where was I going with that? It is something I was kind of interested in initially, but I guess as far as practicing facial plastic surgery, I've just finished my fellowship back in end of June.
Oh, okay.
So I've been practicing in this area now for almost over 3 months, almost 4 months now. I've done some facial plastic procedures, but obviously I'm still trying to build my name and build my brand. And
Sure.
I've found a lot of enjoyment and fulfillment serving the community in terms of general ENT. So it's been a good transition.
Okay. Now, what brought you to Lake County?
That's a good question. I never really knew about this place. I knew obviously about Orlando
Sure,
because
yeah.
of
Everybody knows Orlando.
that little company down in Lake Buena Vista.
The small empire.
Yeah. And so I'd been here before for that, with my family to see Mickey or whatever, and or to experience Disney. I never really experienced Orlando or anything like that. And it was in a really kind of roundabout way. It was through some of these. I was looking at different jobs where I could kind of kickstart my practice without having to just start from scratch with nothing, no infrastructure, with just coming out of training with not a whole lot of business experience. And so in a roundabout way, I got in touch with Dr. Madonna and Dr. Vaught and their practice with Dr. Milstead, and came down here and interviewed and looked at the area with my wife, and who's also a physician, by the way. She's signed with Advent Health as a urologist.
Okay.
Yeah, so she's coming here. Her start date's in March. Basically, it just seemed like the kind of the perfect blend of what we were looking for. We don't really like cold weather, and there's not a whole lot of that down here.
Says every Floridian implant.
Yeah, and she's from Texas. I'm from Mississippi. She wanted sort of a mix of the small town and the big city, and you have access to the big city here with Orlando and with the airport, all of its direct flights, and we just really enjoyed the area. Also, it's rare, I think, sometimes when you join a group to find a group of people that you can really mesh with, that you become friends with, and I think I found that with Dr. Vaught and Dr. Madonna. I feel like I feel like we've really formed a good relationship so far, and a good solid bond where I feel comfortable bringing stuff to them, and likewise them to me. And so far, it's been really lovely being here.
That's good.
Yeah.
That's great, actually, because a lot of times people make a move to whether it be a whole new career or just another location, and it really is kind of a coin toss at that point whether or not you, especially when you're moving such a distance such as that, because you have to move.
Yeah,
so leave everything else behind.
Yeah, we were in Orange Beach, Alabama. The fellowship was in Gulf Shores, but they're right next to each other. It's like Leesburg and Tavares. And then prior to that, I was in Memphis, and I've been all over the place, but never really spent much time in Central Florida. Spent a lot of time growing up going to the Panhandle.
Of course.
Yeah, I've gone to the Panhandle, which is different, obviously quite a little bit different than here. But yeah, I really enjoyed being here so far.
Well, good.
Yeah.
Can you tell us a little bit about Lake ENT, because that is a name that you hear very often around here, but ENT, nose and throat, kind of going back. Everybody has to go to that doctor at some point in time in our life. But let's talk specifically about Lake ENT, because they don't just offer the check your ears and sore throat stuff.
Yeah. So it started out back in, I want to say, like the late 60s, mid to late 60s, as Lake ENT. It was founded by Dr. Bridges, Dr. Cliff Bridges, and it's been around ever since then. Now it's Lake ENT and facial plastic surgery. That was added by Dr. Madonna, and then the separate arm that focuses on facial plastic surgery, aesthetics, wellness, that's face-to-face. We have a face-to-face branch in the Leesburg and the Leesburg and Village offices, and hopefully in the future moving towards expanding that into the Tavares office as well. So that's something new that's up and coming. This practice has been around quite a long time, and it's served this community as really the sole provider of ear, nose, and throat since that time. There's been a few others. There's a handful of other people over the years, and it's currently still that do, but it offers just very comprehensive ENT care in terms of general ENT, audiology, obviously hearing aids are a big service we provide. Really for the entire villages, we're sort of the ear, nose, and throat providers.
Right, because the Village is a large market.
It's an amazing concept, and
it's a cool concept.
Yeah, it is an amazing thing. I never really knew much about the villages. I've heard kind of legends about it, but it's blown up in the last 20 years, really expanded to where I think it's almost 200,000 people live there now.
Yeah, it's amazing, and still growing.
It's still growing, rapidly growing, kind of a retired population, an older population, so hearing aids are big. Because it's Central Florida and it's you got all kinds of flora and fauna, there's a lot of allergies that occur.
Oh, yeah.
So that's a big part of our practice too, is the allergy testing, allergy shots. We have 2 full-time people that just focus on that. We have numerous audiological and hearing aid providers that just focus. They have a whole other group of people that just come to see them. They don't see me or Dr. Vaught.
Oh, right. Right.
And so those are a couple of things, ancillary things that we offer. And then, Dr. Madonna, Dr. Vaught, Dr. Milstead, and I, we all provide, what we call general ear, nose, and throat, which is like tubes, tonsils, adenoids, sinus surgery, functional airway surgery, stuff like that.
Okay. Well, we need to take a quick break, but when we come back, I'd like to continue this conversation and get more maybe into the face-to-face aspect of it.
Yes, of course.
And answer some questions our audience may have. We'll be back in a few moments. Hi, and welcome back to Red Cup Conversations. Again, I'm your host, Kris Poliquin, and this is a production of Red Apples Media. So we're going to continue our conversation with Dr. Samuel Moak from Lake ENT. And Sam, what I'd like to do now is kind of go into more of the plastic surgery aspect of it. And first and foremost, for me and the audience, I find it curious that we still call it plastic surgery. Because when I was growing up and you started hearing more and more of it, it was, I don't know, it kind of taboo to call it plastic surgery, but we didn't know what else to call it. It's a little more to it than that, isn't it?
It is. There's different forms of plastic surgery. If you just use that as an umbrella, there's the type that I practice, which is facial plastic surgery. There's aesthetic surgery, which is more cosmetic type plastic surgery. You could also sometimes referred to as cosmetic surgery. Yep. Then there's reconstructive surgery. And all those different monikers kind of describe the same thing. Plastic surgery as a field initially truly began, you read back in these ancient texts where, the Egyptians were doing rhinoplasty, the Greeks were setting noses back. Right. Mm-hmm. You hear all kinds of stuff, tumor resections and attempts at reconstruction. But really, it kind of really began as a field during World War I and afterwards with all the trench warfare and horrendous facial injuries. There was an otolaryngologist in England named Dr. Harold Gillies, who's kind of one of the big pioneers of reconstructive surgery. He was actually he was an otolaryngologist. Facial plastic surgery began as a field probably around the same time, around the turn of the 20th century. I think at that time, cosmetic surgery in general was considered unethical by most surgical disciplines.
Is that right?
Yeah, it's because surgery was a lot more high risk back then. You didn't have antibiotics. You didn't have good ways of controlling infection, controlling bleeding. Didn't have good ways of putting people under anesthesia. And so the idea that you would do a surgery on someone to rejuvenate their facial appearance was considered too much risk for something that was quote unquote superfluous.
Right.
After World War II, and there was a big boom in medical innovation and advancement, these plastic surgery procedures came more into the mainstream. The modern father of facial plastic surgery, in a global sense, would be Jacques Joseph. He was a German physician who was an early pioneer of rhinoplasty and wrote up some of the early types of procedures that facial plastic surgeons do. And then in America, kind of one of the we consider the founding father of facial plastic surgery was Jack Anderson out of New Orleans. He actually trained Dr. McCullough, who was my fellowship mentor.
Really?
Yeah. And he was a big force in creating, in taking facial plastic surgery, which had then, at that time, had been a branch of otolaryngology, and helping turn it into its own field. And plastic surgery, which is, a plastic surgeon is someone who's done a different type of residency. A lot of times now it's integrated, so to where you match into it out of med school. It focuses on the whole body, so that's breast procedures, abdominal procedures, the whole gamut, hand surgery, burn, medicine, cleft palate.
Right.
Although there are some facial plastic surgeons and otolaryngologists that do that as well. So there's a lot of overlap between those two fields. They each have their own academies now. They have their own separate board process. And it's, to a layperson, it just seems kind of complicated.
Well, it certainly sounds like it's come a long way.
It has.
Like most things. I guess.
Yeah, as far as having their own board process and which would be the American Academy of Facial Plastic and Reconstructive Surgery, American Board of Facial Plastic and Reconstructive Surgery, that developed really in the 80s. And there were some hard-fought battles that had to be fought between the two fields, and now I think they get along pretty well, although some would disagree with that. But basically, we kind of recognize each other as two separate entities that have overlap within the face region, head and neck region. So that would include procedures such as blepharoplasty, rhinoplasty, facelift, forehead lift, skin resurfacing, then all the non-surgical procedures, Botox, filler, facial resurfacing, which includes dermabrasion, chemical peeling, CO2 laser, erbium YAG laser, all these things that are done now that both fields kind of share. And so
that is just so much. I mean, how far we've advanced in that area, for lack of a better term.
Well, it is, and really the last 10 years has seen a big explosion in non-surgical rejuvenation of the face.
Now, this is, again, we're talking like Botox and things of that nature.
We're talking more cosmetic. Reconstructive wise, that's a whole different ball game. A lot of those techniques. I think the biggest advance in reconstructive surgery would be, and it occurred in the 80s, was free tissue transfer. But I don't do any of that. That's more into the head and neck cancer realm.
Gotcha.
But in terms of cosmetic surgery, the real trend now is non-surgical rejuvenation. There's a lot more options just within, like I said, the last decade. Botox kind of came onto the scene as a cosmetic product around 1999. And really 2002 is when it was approved for glabellar and forehead rhytids, or wrinkles. And so that's why that term is kind of come along like Coke or Kleenex or Q-tip as as a trade name that has become a grab-all name for any kind of plastic surgery. Oh, that person looks really Botoxed, or I'm going to go get Botox, which really means
it's more of a we treat it as a general term.
It's a general term. In terms of filler, which is the most common kind, is hyaluronic acid that's used today, which your body breaks down naturally. That's to kind of fill in areas that have sort of sagged or things that have descended with time. That's seen a huge advancement, really in the last 5 to 6 years. There's so many different options, and everybody's trying to do it too, but not everybody can do it as well as someone who's been trained properly to do it.
Oh, for sure.
Yeah.
Now, kind of along those lines, what I would like to ask is, because you've been doing this for a while, Dr. Madonna has been doing this he's got a lot of years of experience, like 30 plus, and so being where you're at now, what trends do you see? Is there certain procedures that are becoming more popular, whether it be cosmetic or necessary, for lack of a better term?
There has been an uptick in certain things, and a lot of it has to do with social media, with people of all ages wanting facial plastic procedures, in particular of the face, because everyone is showing themselves on Instagram, on Facebook.
Right.
They're looking at themselves on their device, and the old adage, the camera adds 10 pounds, and everyone wants a sharp jawline. Everybody wants better looking cheekbones. Everyone wants no wrinkles, and you want stuff that can be done like that, because we live in a society of that.
Oh, yeah. Right now. I don't want to wait.
Yeah, of snap your fingers, let's get it done. Mm-hmm. Let's come in for a visit.
And I want to see immediate result.
Yeah.
I want to walk in, walk out looking the way I want it.
The trends for facelift and rhinoplasty, blepharoplasty kind of stayed about the same. I would say that in terms of facelifting, in the last 15 to 20 years, there's been a larger increase in it used to be that the majority of people that sought that out were female, and maybe a smaller percentage male. And now that percentage is more about 60-30 now.
Really?
Across the board. There's more men are wanting to do it. It's more acceptable.
That's what I was going to go at.
It's a little more acceptable. And not to say that it wasn't acceptable in the past, but looking back into like the 60s and 70s, it was just not something that men sought out. But now it kind of is, and
well, then it seems like people are a little more open about having procedures. There was a time where they would go have something done, come back, and this is me.
I think that,
and now it's like, oh, look what I've had done.
Yeah, that's true. That's true. There is a good deal of that, and there's people wanting to showcase it some. Mm-hmm. There's still a lot of folks that want to keep it anonymous. They want not anonymous, but keep it
private.
Private, yeah, not as known, and that kind of plays into the techniques that we use to try to. You don't want it to look like someone's had something done. But in terms of other things that are trendy, obviously all the non-surgical stuff, fillers, Botox, microneedling with PRP, and the use of PRP in general, which is platelet-rich plasma.
Okay, I was going to ask.
That's something that people are really trying to do all kinds of stuff with, and have been for really like the last 5 or 6 years. It's a substance that's derived from your own blood, so you're not getting it from made in a test tube or produced in a laboratory. You draw up your own blood and spin it down, which is an age-old technique, and you draw out the serum, which it looks like a yellow liquid, and it's what the plasma kind of sits in with the platelets as part of the blood, and it has all these. The bottom line is it has all these growth factors and these proteins and substances that help stimulate collagen growth, help stimulate healing, help prevent hair follicles from breaking down. Yeah, it's almost like a miracle drug. It's used to.
But it's because we're producing it ourselves.
Yeah, it's always been there. It's always been there, but we've discovered that you can just refine it from a test tube of blood, and so microneedling has come along. It's a type of procedure where you're producing a lot of tiny little holes all along the skin, and then what we do is we rub the PRP on there, and the whole process helps stimulate new collagen growth and produce improvement in the texture of the skin, the quality of the skin, the tightness of the skin. So it's not a substitute for surgery, but it certainly can give you an improved appearance.
That blows my mind.
Yeah, and
blows my mind.
And some people advocate to use it as an adjunct to, say, like a facelift to help maintain, particularly if you have a lot of skin laxity, you have kind of that more aged, sun damaged skin, skin that doesn't have as good elasticity. You always get some relaxation, but the thought is that you can come back in with the PRP and microneedling and help maintain its tightness. And so there's some leaders out there in the field that are already looking into that.
Well, there's no way we can get all this information into a 25-minute show. If someone wanted to get more information or to contact you guys directly, how can they do that?
Any one of our office numbers, they can set up a consultation with either Dr. Madonna or myself.
Okay.
And we just come in and have a conversation like we're doing now. And I use a mirror to kind of show them I give them an overall assessment, kind of learn about them as a person, what their goals are, their overall health. And I like to get people in front of a mirror and show them kind of what I see, give them my opinion, what would be best. And I don't try to force anything, but I try to educate. I try to point things out.
That's all the time we have for today, Doctor. Thank you again for coming out and sharing some of this information with us.
Well, thank you for having me again.
All right. And that wraps up this episode of Red Cup Conversations. I've been your host, Kris Poliquin, and we'll see you next time.